A startling projection on the spread of Omicron from the World Health Organization. It says forecasts show that more than 50% of Europe's population will be infected with the fast-spreading variant within 2 months. WHO's Europe Director Hans Kluge says the region has seen more than 7 million new COVID-19 cases in the first week of 2022, with infection numbers more than doubling over a 2-week period. And as cases surge, hundreds of thousands have been forced to isolate. Some European countries are easing restrictions to keep essential services running. And Trent Murray joins us live now from Berlin. Trent, what exactly are some of the measures the WHO recommends Europe to take in order to minimize the impact of Omicron?
Well, it does make for sobering reading, doesn't it? The WHO saying just in the past few hours that 1 in 2 Europeans will catch COVID-19 in coming months, fueled largely by the Omicron variant. And for that reason, they are calling on European lawmakers not to take their foot off the gas, if you will, with restrictions and the like in order to try and minimise the community spread. In fact, the WHO says the global risk of COVID-19 still remains very high overall, and that the current data indicates that Omicron has a significant growth advantage over the Delta variant. In other words, it is far more infectious, which we know, of course, from the data. They're calling on European governments, therefore, to take several steps in order to try and slow the spread. They include things like stepping up surveillance, in other words, trying to find fresh outbreaks, super spreader events, and then contain them. Also, to step up testing, especially in cities where you are seeing a surge of cases, places like London and Paris and Berlin, and also prioritising research around the virus itself, trying to find out more information about the characteristics of the virus. And then finally, those social measures that we've all become very used to, things like tight-fitted masks, washing hands, keeping rooms ventilated, and physical distancing. But I should stress that the WHO says the number one thing that remains effective in trying to slow Omicron is vaccinations. They say, quote, all of the approved vaccines do a very good job protecting against severe disease and death, including from Omicron.
Now, Trent, as we all get used to living with the virus, I'm wondering what did the WHO say about how endemic COVID-19 is right now?
Yeah, it's a very good question, of course, because we do hear so often about living with the virus becoming the new norm. And the WHO does say that the early data from places like South Africa and the UK does suggest that there is a reduced risk of hospitalisation for Omicron when compared to Delta. In fact, they say that that data suggests that the requirement for, say, medical ventilation is much lower than the Delta variant. And as such, we are now starting to see a decouplisation from hospitalisations to case reports. In other words, whilst case numbers may be very high, the hospitalisation and admission levels are perhaps not as high as they were on, say, the Delta variant or the Alpha variant. And for that reason, it's becoming clear that perhaps the virus is now becoming a bit more endemic, a bit more circulatory within the community. But nevertheless, they are saying that doesn't mean it's a green light to start lifting all of the restrictions, that hospitalisations are only one metric for which you can measure the pandemic. So they are just still asking for caution as we can continue to roll out more vaccines, including boosters, and make sure that the hospital system simply isn't swamped by the sheer volume of people coming in that may have Omicron, given the numbers that we are clearly expecting to see over the next 2 months.
Trent Murray from Berlin, thank you.